This is my audience. Hi, everyone.
Hello.
Hi. I'm the doctor.
All right.
When you drop it.
Please don't drop it.
Yeah.
Imagine this. You have just been told by your primary care physician that you have been diagnosed with an incurable disease, and now you have mere months to live.
Sure.
Your physician then informs you that you will not go easily. It will be slow and excruciatingly painful. And for the rest of your numbered days, you will live your life in a hospital bed. As time passes, you find yourself hooked up to countless machines in the hospital. Doctors and nurses do whatever they can to help you find some kind of restful comfort, but your withering body is always overtaken by the intense suffering and almost unbearable pain that is a constant. In addition to your deteriorating health, you are also struggling with your body's attempts to cope with the side effects from numerous medications you are given. Constipation, dizziness, possible breathing, trouble breathing, and you feel that you have no appetite since you're constantly nauseous. You know that there is absolutely no chance for your survival. And death is imminent. You're gonna die. It's just a matter of when it will happen. Now ask yourself this. If you have the option to choose how and when to end your life, and in doing so end your suffering, would you take advantage of that opportunity? Currently, only the states of Montana, Oregon, Vermont, and Washington offer the option of physician-assisted suicide, which is or PAS. PAS is an extremely controversial and currently illegal practice within the remaining 46 states, to include Washington, D.C. PAS occurs when a physician facilitates a terminally ill patient's death by providing the necessary means or information to enable the patient to perform the life-ending act. Most commonly, a patient makes a request and the physician prescribes a type of lethal medication. It is a humane way for the terminally ill to end their lives with dignity rather than having the illness reduce them to a shell of their former selves. Personally, I believe that physician-assisted suicide should be a legal option for terminally ill patients throughout the United States. Physician-assisted suicide has its proponents and its opponents. Among the opponents of PAS are some physicians who believe that it violates the fundamental tenet of medicine and believe that doctors should not assist in suicides because to do so is incompatible with a doctor's role as a healer. However, as quoted in the modernized version of the Hippocratic Oath, which is sworn by all physicians and physician assistants, most especially must I tread with care in matters of life and death. If it is given to me to save a life, all thanks. But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own. Above all, I must not play at God. In a sense, physicians who provide assistance in hastening death are adhering to a long-standing tradition of the scope of medicine practice, to care for and meet the needs and desires of patients in all stages of the patient's life. There are many that believe that the outlandish idea that if PAS were to be legalized, patients or patient families would seek to misuse the opportunity. To mitigate this notion, there are specific eligibility requirements that are set in place to prevent the abuse of this medical option. In all states that have legalized PAS, the patient is required to be at least 18 years of age, a resident of the respective state, capable of making and communicating healthcare decisions regarding their well-being, and they must be diagnosed with a terminal illness that will lead to their death in no more than 6 months. Also, the decision must be voluntarily expressed by the patient to their physician twice verbally and once in writing. There are many safeguards in place to ensure that all parties involved make an informed decision and the right is not abused. In conclusion, I believe that physician-assisted suicide should be legalized throughout all 50 states. The United States Constitution and the Bill of Rights are considered to be the foundation of our nation, and documents such as these were created to provide the people with freedoms and rights. Legalizing physician-assisted suicide is just another right that people should have so that they may have the freedom to make their own choice when they're facing death.
That's right.
If this option is not available to all people, their lives may be prolonged for a short period of time. However, their quality of life may be severely compromised.
Yeah!